My name is Donna, and I was having such pain in my shoulder, well, not my shoulder, just in my arm, in the muscle part of my arm, and I was driving one day and I felt something snap. I usually get real nervous around a doctor, but he made me feel real comfortable. I went, I think it was in January, February, and they told me then that I had a torn ligament or something in my shoulder, which I didn't think it was my shoulder at all. I thought it was my arm. And he just x-rayed it, got me right in, and within a few weeks it was over. And I have had no problems at all since.
Donna Moore came to me with a long history of right shoulder pain that was progressively worsening. It was affecting her sleep. She couldn't sleep on the right side. She had problems with activities of daily living, which includes washing yourself, dressing yourself, those kinds of things. She had been managed appropriately, non-operatively to this point. She had had physical therapy, she had had cortisone, activity modification, all of those things, but was still just frankly miserable. And so when I saw her, we took a look at her. She still had good range of motion. She had full forward elevation. You know, she could get her arm all the way over her head. But she had quite significant weakness and pain when we tested her rotator cuff. So what's the rotator cuff? There are 4 muscles that make up the rotator cuff. And what they do is they stabilize the shoulder and they allow you to elevate your arm. And so the 4 muscles, this is a model of the shoulder. And so this is the clavicle, the collarbone, this is the scapula, the shoulder blade, and if this was my arm, it would sit something like this. And so the top of the arm, the humerus is the bone we're talking about. The humeral head is held in the socket or the glenoid by the rotator cuff. And so as I stated, there are 4 muscles. There's one in the front, that's called the subscapularis. There's one on top, okay, that's right here, and that's called the supraspinatus. And then on the very back, you've got 2 more, the infraspinatus and the teres minor. And all those 4 of those muscles work to hold the ball in the socket, stabilize it, provide a nice platform, stable platform for the rest of your muscles to elevate the arm. Well, Miss Moore had a tear involving 2 of those 4 tendons. The supraspinatus, which was the one on top, and the infraspinatus, this one in the back. And so she had a tear that started about here and went all the way back around like that. It was a very large tear.
I couldn't lay on my shoulder, this arm at all. Very uncomfortable. It probably went on for a little over a year before I decided to get it done. Everybody would tell me it won't work. You'll never get the use of your arm fully back, but I have 100% use of my arm. So I'm really thankful for that.
We did the surgery. We got the tendon, both tendons back to the humeral head, repaired nicely, minimal tension, and she was very compliant and followed all the post-operative instructions, and she has just done wonderfully. I know she couldn't, and I certainly couldn't, as her surgeon, be happier with the outcome of her surgery.
I would recommend Dr. Farrell to anyone because he is, in my notion, the best around.